Hello, this is Dr. Rhonda Johnson. Today is Thursday, March 3rd, 2022, and this is part 3 of my message on the White House National COVID-19 Preparedness Plan. And again, this is a 96-page document that was released by the administration under President Biden to prepare our nation for COVID-19 or any other pandemic that should come along. I think this is an enormous progress. I do not work for the government. I just wanted to disclose this. I am looking at this document as a citizen and as a physician and as someone who has public health expertise. Part of the problem for this pandemic is we weren't prepared to mount a full national response to this highly contagious virus. So I see this as progress going forward. So the part that I'm going to talk about today on this message is the testing plans and the preparation to detect new variants. So the administration reports that there are 21,500 free COVID-19 testing locations around the country. And they also stood up the covidtest.gov website so Americans can order tests that are free and shipped directly to their homes. Now, President Biden announced that people who ordered their first test can reorder, because we have to remember these tests expire after several months. Now, private insurance, Medicaid, now cover rapid at-home tests for free, and Medicare will fully cover these at-home tests starting this spring, according to this plan. And the White House plans to scale up domestic manufacturing capacity to make rapid tests and the testing infrastructure run smoother, and to invest in innovation to make these tests less expensive. So those are the plans. Now, the next part of this document has to do with preparing for new variants. The CDC has stood up the National Wastewater Surveillance System, it's called NWSS, to track the presence of the virus in wastewater samples across the country. This is tied a lot to our public health facilities. They've also shored up the CDC infrastructure so that they can do sequencing. This was not in place before. They're now sequencing up to 90,000 isolates a week, which will help detect a lot more of these variants. They've assembled a team of researchers, both academic and commercial, to assess these mutations, and they have built a robust emergency response infrastructure. That's my message on testing and how the administration hopes to detect new variants. As always, my views are my own.